This is a post-operative rehabilitation protocol for an arthroscopic rotator cuff repair. It is anticipated that your shoulder will become stiff in the weeks following surgery. Allowing the shoulder to stiffen after surgery facilitates healing of the repair. It is expected and necessary following the repair, and it will resolve with the help of physical therapy. On the day of surgery, after surgery, you should use ice or cold therapy over the shoulder for 15 minutes every 1 to 2 hours to decrease pain and inflammation. Begin taking the pain medication as soon as you have pain. Do not wait until you are in severe pain before taking the medication. We expect that you should be able to stop taking the pain medication within 2 to 3 weeks. Begin eating with liquids and light foods. Progress slowly over the 24 hours following surgery. Keep your dressings dry on the surgical site until your first post-operative visit. Usually this is between 7 to 10 days after surgery. You may bathe or shower after surgery, but keep the dressings completely dry and the bandages on. There is no swimming until instructed by your surgeon. You must continue to use a sling until your first post-operative visit. You should expect to wear the sling for 6 weeks following surgery to allow time for the shoulder to heal. Do not drive until instructed to do so. You will begin formal physical therapy 7 to 10 days following surgery. We will give you a prescription and list of recommended facilities to contact prior to the surgery. It is normal to experience swelling and bruising in the arm, elbow, and wrist. You may bend the elbow and wrist. This will decrease the amount of swelling that you may have in the arm. It is very helpful to keep the arm elevated on 2 to 3 pillows so that the arm is above the level of the heart while lying down. There are 4 main phases of rehabilitation in addition to the early post-operative phase. The goal of the post-operative phase early on is to control pain and swelling and to begin a passive motion program. You should rest an icy affected shoulder. Continue to sling at all times except when bathing. Straighten and bend the elbow, wrist, and fingers several times per day. Work on shoulder shrugs, scapula squeezes, ball squeezes, and passive shoulder range of motion. Avoid active elevation of the arm. Avoid lifting objects with the arm. Shoulder shrugs, as demonstrated in this photograph, are when you shrug your shoulder and hold it for 5 to 10 seconds. Lower your shoulders down and repeat it 10 times. Scapula squeezes, as demonstrated in this photograph, involve pulling the shoulder blades together and holding it for 5 to 10 seconds and repeating it 10 times. Ball squeezes, as shown in this photograph, are self-explanatory. Squeeze a tennis ball or small squeezable ball on the surgical arm. Elbow range of motion should be done without the sling on. Straighten and bend your elbow as far as you can tolerate. Do this 10 times slowly. Also work on forearm pronation and supination as demonstrated in this photograph. Do this 10 times slowly. Shoulder range of motion is divided into passive and active range of motion. Early on, you should use your non-operative arm to lift up your surgical arm and do not lift the elbow higher than 90 degrees of elevation or higher than your shoulder. This is considered passive motion when you or someone else lifts the arm, not active. The restrictions of physical therapy in the early post-operative phase are passive forward flexion to 120 degrees, passive external rotation to 30 degrees, scapular isokinetics, and pendulum exercises. The goal in phase 1 from week 2 to 6 is healing of the rotator cuff and restoring passive range of motion. You must wear the sling at all times, except when bathing. You must wear it to sleep. You are restricted from active elevation of the arm and lifting objects with that arm. In phase 2, the goal is full range of motion, beginning a rotator cuff strengthening program. This occurs after week 6. You discontinue the sling after 6 weeks. You use various modalities for pain control. Passive and active range of motion, biceps, triceps strengthening, scapula stabilization, a rotator cuff program once your range of motion goes beyond forward flexion of 90 degrees and abduction of 90 degrees, pulleys, and pull therapy for range of motion. The goal in physical therapy is that you learn a home program to do it on your own. In phase 3, weeks 12 to 18, the goal is full range of motion and strength to 90% compared to the other side. You continue with aggressive physical therapy. In phase 4, greater than 18 weeks, you advance to sport-specific activities. The goal is to return to sports.